Okay, so at this point, if we could bring up the COVID-19 staff update team, we'll hear that update.
And Anna will not be joining us today.
You want to kick us off, Marilyn?
You bet. Thank you very much. Marilyn Mann again, Health and Human Services. And today we move beyond the blueprint, and there's a lot of changes going on. As locally, our numbers have remained pretty steady. We remain at 1,434 cases, relatively low number of new cases over the last couple of weeks. None that we've identified tied to the Mule Days event, and so that's a good indication of some community strengthening of our resiliency and a level of vaccination that's protecting us. We have been downscaling our emergency operations, and we are moving more into a departmental operations center. You will notice some changes to the website that started yesterday and will continue over the next day or two as we update the website to reflect the move beyond the blueprint. We won't be, the banner that has the daily case counts will no longer be there. Instead, we will be issuing a weekly update to the community and to those who sign up for the distribution. And that update will include our rate of vaccination, as well as any case numbers or changes in case rates. We've just been very excited about some of the changes that this is going to allow for our business community. As of today, the businesses are able to open with no capacity limitations. Now, there are still some requirements around mega events with 5,000 or more people indoors or 10,000 or more outdoors. And there remains some guidance on how to safely operate an industry that are available through the state website. And we will be providing links to that information on our website as we continue to do the update. The face covering guidance also changed effective today, and so it's important to know that if you are a fully vaccinated person, you are able to enjoy everyday activities without a face covering, including in indoor venues. Now, there are some exceptions to that. If you are in public transportation, if you are indoors in a school setting, childcare setting, and in healthcare facilities, correctional facilities, homeless shelters, emergency cooling centers, those types of venues, people are still required to wear face coverings in those venues. I do want to make note, though, that if you are a business and you are under the OSHA guidelines and requirements, you will need to follow those. So, for example, as a county entity under the OSHA guidelines, we continue to need to wear face coverings if we are not in a room by ourselves with a door shut, or if we are anytime we're in a room where there are a mixture of vaccinated and unvaccinated persons. So now that is being looked at by the OSHA board, I think on the 17th of this week, of this month. And if they do make changes that align more with the current state guidelines, then that would be enacted at the end of the month. So we will continue to keep that updated information on our website. And other than that, our vaccination, we continue to vaccinate, and we're running very close. We're just trailing the state rates for both fully vaccinated and people with at least one dose. And so of our eligible 12 and older population, we have 55.5% are vaccinated in Inyo County, and 64.3% have at least one dose. And that was as of last night. And we continue to encourage people to get vaccinated, as it is one of the most effective ways to prevent the acquisition and transmission of the disease. And I think Dr. Richardson is going to speak to the vaccine a little bit and its safety as a reminder.
Morning, board. James Richardson, MD, Inyo County Health Officer. I was asked to speak a little bit about the vaccine safety because there are always questions about that. And as of June 7th, last week, there's been 302 million doses of COVID-19 vaccine administered in the US. That's a significant number of doses to assess the safety. Usually a vaccine reaction occurs within 6 weeks after the vaccine delivery. The FDA required the study period to be at least 8 weeks to make sure the safety standard was met. And the COVID vaccines underwent the most intense safety monitoring by the FDA compared to other vaccines. And this was because of the pandemic. They felt that they had to really be on top of all the issues and were watching all the reactions that occurred. 3 major concerns did develop during the period of time of the vaccines. Early on, there was some anaphylaxis. I think there was 12 cases after a couple of million doses, and all those cases were treated and recovered quickly. That's why we monitor a vaccine status and side effects between 15 and 30 minutes after the dose. All those patients did well, and they were usually allergic severely to some other agent. We screen for that when we give the vaccinations. The second issue that came up, which was related to not the messenger RNA vaccines, which is Pfizer and Moderna. The reaction came up with the vector-borne vaccines, the viral vector vaccine, which was Johnson & Johnson Janssen vaccine. After over 1 million doses, there were some clotting disorders with low platelets. And platelets are those little particles in blood that cause clotting. And this occurred in several women, only women, between the ages of 18 and 49. This was extremely rare. The cases were 7 per million doses of vaccine delivered of the Johnson & Johnson. That came out to be 0.007%. So the cases were extremely rare. The CDC paused the use of the vaccine, as you remember, approximately 6 weeks ago to study the situation. They came up with a warning to have vaccinators screen individuals and let them know that if you're a female during that age range of 18 to 50, that this reaction has occurred in the past. Again, this is extremely rare. They release the vaccine back into use and they continue to monitor any side effects. The same issue came up with the AstraZeneca vaccine, which isn't licensed in the US, which is used in Europe and some of the other countries. That's also a viral vector vaccine. So this syndrome was unique to the viral vector vaccines, not the messenger RNA, Pfizer, Moderna vaccines. And the last thing that has come up recently, which is also extremely rare, is a condition called heart inflammation, myocarditis, and pericarditis, which myocarditis affects the heart muscle, pericarditis affects the outer lining of the heart. The cases were small. This week, I think June 18th, the Advisory Committee on Immunization Practice is going to meet and discuss that issue. The numbers have been extremely low. The symptoms have been treated easily and no patient required hospitalization, and they were back on normal lifestyle within days. So the condition is rare, extremely rare, and it occurred in the adolescent population up to 16. It was mostly males. So it's not a big concern, and the benefits of the vaccine on all of these conditions I discussed, the FDA and the CDC and the ACIP have considered these vaccines. The benefit and the safety of them is much greater than the extremely rare side effects that I mentioned. Now, one other statement of concern, not concern, but people ask me in my practice, would I get the vaccine? If I thought there was some safety issue, I would not have gotten the vaccine, and I wouldn't have asked my family to get the vaccine. So that's a testament, I feel, to getting the vaccine. I wouldn't subject myself to some possible side effect. In fact, some of my members in my extended family also got the J&J vaccine, and they did quite well. The utility of that is a big benefit for subsets of population because it's a single dose vaccine as opposed to the 2-dose vaccine for Pfizer and Moderna. So there's been no serious sequelae of these vaccines with a myocarditis and a pericarditis, which is being studied right now. The other statement I'd like to make is about pregnancy. The risk of getting the disease in pregnant ladies is very high with complications, hospitalizations, severe disease. So it's been recommended that they get the vaccine, and also there's been some fetal anomalies, not necessarily anomalies, but preterm births. So the recommendations are that they get the vaccine, the safety of the vaccine versus the risk of those complications. The safety is much greater, and the benefit is profound for pregnant ladies. The recommendation is for individuals that are pregnant to take it up with their provider and decide between them whether or not they should get the vaccine. And as with any vaccine in the past, once you start getting millions of doses out, you may see some unusual reaction. But at this date, there have been millions and millions of doses given, not in our country, but all over the world. And the side effect profile is extremely low compared to the huge benefit. And our county can speak to that benefit because our cases now are 0. And like Marilyn said, post Mule Days, we haven't seen any cases, and that's a testament to the vaccination of our public and probably vaccination of the individuals that visited our county. What other interesting information that you may need? variants. The vaccines are effective currently on the variants that exist in the US. There's 6 variants that are of concern in the United States. One of them is the United Kingdom variant, which is probably the most prevalent. And these 6 variants are being monitored. The variants are categorized and classified as variants of interest, which are variants that are really no concern, and then variants of concern, and then variants of high potential problems. So there's no high risk variants in our states at this point. They may be globally, but in the United States, we have no serious variants, only variants of concern, which are being monitored, and they're protected by, and they are effective. The vaccines are effective against those variants. And I understand Moderna may be tweaking their vaccine to cover a couple of the variants, which may be used in a booster sometime in the near future. And that information is yet to come. That's about all I have to say about the vaccine, the safety. I think it's extremely important to realize these vaccines, the safety profile has exceeded probably all expectations, and also the efficacy of 95 to 94% for the messenger RNA vaccines. It's unheard of for prior vaccinations. And I'd like to close by saying that it's been a pleasure for me to work with the board. They've given us a lot of support and encouragement. It's been a long 14, 15 months, and we probably couldn't have gotten here without giving some tribute to the individuals and personnel that have worked behind the scenes, that have made everything work like a Swiss watch. We have had tremendous cooperation, and I've been impressed about HHS employees and the public health employees. None of this could have been achieved without them. So that's my update today.
Thank you. And I think we just want to leave as we move beyond the blueprint and localize our response efforts to the department level. We just wanted to do this reminder about the importance of vaccination and the safety of vaccination, and encourage those who have not been vaccinated to discuss it with their physician. Thank you.
Thank you.
While we're passing those comments out, Dr. Richardson, none of this could have been achieved without your factual information, keeping us all informed of what we really should be doing. Thank you so much.
Thank you, and you're welcome.
Yeah, I have been, well, I've said it before, I think Dr. Richardson matched our county's approach, and that's why it worked well, that we could work well together. I did have one question. I know there has been a concern, as we started to vaccinate younger people. You feel like that's still safe and going okay? I mean, I get it that maybe, I agree that maybe there's no need to rush to do it, but are you feeling like that it is being safe?
I believe at this point, what has been determined, it is safe. The conditions that have been reported are small, which is the heart inflammation, myocarditis, and pericarditis. The symptoms are mild, they're easily treated, and full recovery occurs. So the recommendations are to still move forward with the 12 to 15-year-olds, and I believe at this point it is safe. Long-term side effects usually occur in patients 6 weeks after the vaccine. And you can see we're well beyond 6 weeks in most individuals. The CDC and the FDA feel the vaccine for children is necessary and safe with rare cases of this myocarditis, pericarditis. The benefit outweigh the risk. That's the way they put it.
Thank you.
Thank you. Thank you for the update and report. And I know how diligent and how hard everyone from public health and HHS worked. And I think it's also important to thank so many members of our community and our business community who really did bear out the consequences of this pandemic as well. So anyway, thank you both and your departments. I did have one question a few weeks ago or several weeks ago, Dr. Richardson, you had advised that for children 12 to 15, certainly for parents to engage with their physicians and to really proceed with that awareness. And I've noticed since then that more and more schools are stating that for children to come back to school, well, certainly university students, but it looks like it's being considered at all levels now, they'll need to be vaccinated fully. And I'm just wondering within the county, what are we seeing with that, with vaccination, and what kind of numbers, percentages, concerns, no concerns, what are we seeing in Inyo County and perhaps even from a wider scope?
Well, I've noticed that there was at the vaccination clinics, the larger vaccination clinics, I was at each one of them. And since the recommendation for the 12 to 15-year-olds came into play, there has been a significant number of parents that arrived with their adolescents, and they're very encouraged about giving the vaccines. They have a sheet that they've signed that they've reviewed the side effects and the benefits. So at this point, I think the acceptance is good. Now, there may be some reluctance in the teenage, like the 19 to 30-year-olds. I suspect that there is some resistance in that group. I know my 19-year-old son is required to get his vaccination before the fall semester. That's probably going to occur in a lot of the universities. I suspect that'll be what's going to occur. That's, like I said early on, vaccine certification. Many businesses are going to require it.
Yeah.
Cruise ships, large venues.
And right now, though, public schools, it's not a requirement for public schools, but public schools are under currently continued face covering requirements. That's
correct, yes.
Is there a discussion for fall? What will happen, or will anything change?
The last that we've heard is that there is some discussion at the national level with the CDC around updating the recommendations for face coverings in school settings. And, you know, so there's always that potential. I don't know that there would be a requirement for the vaccines, given that it's still in an emergency distribution status.
Yeah, I've been under the impression for several months now that the federal government is not going to get into, which will be the CDC and FDA, is not going to get into mandatory vaccinations. It'll be up to the communities with their businesses, and they may require it in the military, but I don't think they're going to take it any further than that. The universities and the private sector are going to make that decision, I believe. Now, Maryland could be updating on something new, but I've been under the impression the federal government is not going to step into mandates.
No.
And then Marilyn, you mentioned that the Cal OSHA would be, I think they're meeting the end of this week. And then we hope to hear some of their decisions by the 27th or something like that.
Well, if in fact they change and adopt new standards on the 17th, then that would go into effect, I believe, the 29th.
Okay.
There's a waiting period for it, or maybe it's the 17th. The 27th, but it's the 27th or 29th.
Okay. And then my last question is, will we discontinue there's 4 times a week testing? Will we suspend that or discontinue that?
I do believe that there will be some adjustment to the testing, and Anna is not here this week. She's the closest to the testing group. So I don't know offhand, but I do think that there is going to be some winding down.
Okay. Thank you very much. And I agree with Supervisor Kingsley. I think this was the right, our leadership was the right fit for Inyo County. Thank you.
Yeah, I'll just echo that. Just the steady, reasonable, balanced leadership has been welcome and effective, science-based and measured. I think it's gone a long way to making this go as smooth as possible for the entire community. So thank you. We have a hand raised. If we could promote Mr. French.
Good morning. Can you hear me?
Go
Yes.
ahead, sir.
Yes. Good morning, board and health officials. I was beginning to think that I was the only one doing any research on the adverse effects of the vaccine. So thank you very much for the report this morning, Dr. Richardson. It was very thorough, and the CDC did disclose in their June 10th meeting that as of May 31st, 475 cases of myocarditis or pericarditis were reported to players of Americans aged 30 and younger. So there was an issue, however slight it might have been. These conditions can be very serious. And my information said that many of them were hospitalized. So there's a little bit of conflict in the information there. But anyway, I remain critical of vaccinating children with an experimental vaccine that hasn't been fully proven yet. I understand the numbers are low in the adverse reactions, but why take that risk on a segment of our population that has very little risk of even getting the disease, much less dying from it. So anyway, I stand on that position, and I would appreciate, Dr. Richardson, if you would keep bringing up the information on the adverse effects. That's very helpful. I think it would be helpful to more than just myself. And thanks for taking my call this morning.
Okay, thank you for your comment, Mr. French. Does anybody else have any comments or questions?
Just to thank all of the people, Dr. Richardson and the whole crew that's worked so hard on this. I know that this is not what doctors normally do. Doctors usually get thanked, not yelled at. So I know that all of us have been yelled at and very few thank yous, but you've done an excellent job, wonderful job for this community. And I want to thank all of you for doing that.
Thank you.
Okay, thanks. And it'll be a few weeks till we see you again. And at some point, we'll stop doing these all together. So look forward to that day.
Okay,
Thanks.
bye.